entrance to the Federal Medical Center when we took over. Okay. I mean, if you are entering into an institution, the entrance is absolutely very important. It gives you an idea of what you are going to find inside. Okay. And then, brick by brick, block by block, we started working. On the left is the picture of the theater when we came to the Metal. But on the right is the picture of the theater. And today, as at the time we came to the Metal, we had 11 theater suites. We had 2 theater suites at least. Okay? But today, we have 11 theater suites. And each of those theater suites, this is real picture. You can see even the name of the institution on the wall. This is real picture of what was done. It's not just that. Look at the accident and emergency, okay, that we met there. And look at the one that was constructed in place of it. Okay. This is the admin block of the Federal Medical Center to the left-hand side. Wow. So today, this is the admin block that we have in the institution. All right. Now, the CSSD, for people who are doctors, they know that the CSSD is the heart of the operation of every hospital. So we brought in a CSSD that was the first in the country. And today, we are the only training center in Nigeria for CSSD training. I showed you, okay, this is the laboratory where the results are coming out. You can see to the left, the original laboratory that was at the Budemeta when we came in. But we knew that the lab is the heart of the hospital. So you can see what we replaced it to. And to really understand what impact this has made. When COVID came, all right, most states would only be able to do maybe 200, 300 COVID tests in one day. And so you had a situation where people would take COVID sample and for weeks they are waiting for the result. We, in the Budemeta, when COVID came, we were able to roll out 2,000 minimum results every day. And then I always show this picture because on the wall to the left was when I first became MD, a 72-year-old woman or thereabout who was admitted in the hospital. All right, and then I went to meet her. Mama, I hope you are fine. And he said, MD, look around you. How can I be fine in this environment? All right, but see what we have replaced that word with. All right. So these are also other wards, all right? Okay, this is our pediatrics complex, all right? This is the intensive care unit. When we came into Adedamola, we had only one bedded intensive care unit. By the time we went in, we had one of the most sophisticated intensive care units in it. And we had 16 bedded intensive care units with centrally connected monitors, just like in every of the world. Every patient in Adedamola, every patient on the bed had its own monitor. We do not wheel monitors around. And all the monitors are connected together to a central monitoring system. So these are some of the, I'm trying to speed up because I want to keep to the 20 minutes. All right. So these are some of the before and the after pictures that of some of the work that we did in the Budemeta. But it's always important, even when you are doing well, or people say that you are doing well, that you must bring in independent assessors. We, and I repeat, we were the first public hospital in this country to bring in an independent assessor. We brought in SafeCare, which is a Dutch international agency. We opened our books, including our financial books to them, to look at our books, look at our structure, look at our process, and look at our outcome, so that we can be sure that we are actually doing well. And they brought out the results. The result shows that all the service elements have improved tremendously. This is the result they brought out. They also brought out that all the thematic areas of the hospital had improved very well. And at the end of the day, we became the first public hospital in this country to be granted a level 4 safe care hospital. Till today, we still remain the only public tertiary hospital in Nigeria that is a level 4 tertiary hospital. And so part of the tracking of the impact that we had made also was tracking of our patronage. You can see, as of 2024, we had increased the number of outpatient patients that we see by about 400%. We had increased the dialysis that we're doing by 1,000%. We had increased the incubator care that we were doing by 425%. And we had increased the ICU usage by 1,250%. Right. So the same thing, you know, also the income of the hospital also had increased. When we came in, unfortunately, some of my colleagues are here. The income, because of leakages and other things, was about 30 million. But by the time we were leaving, the income of the hospital had grown to above 500 million per month. So, ladies and gentlemen, the Federal Medical Center Adedamola today is a 450-bedded multi-specialist hospital, the only safe care level 4 hospital, all right? And today we have, like I said earlier, 11 state-of-the-art operating theater. We have 16 ICU beds. Okay? We have fully equipped CSSD that has trained 18 hospitals, 18 different hospitals in this country. All right. We have a complete radiological department. We have 12 functional training centers, and we are the only tertiary hospital today that has a pneumatic transport system. What does a pneumatic transport system do? A pneumatic if most of you have gone to the hospital, you will find out. You want to take your blood, they will say go to the laboratory. You get to the laboratory, they will say go to this one, go to that one. No. What the pneumatic transport system does is that wherever you are, your doctor will take your sample there, okay, and put it into the pneumatic system. And from that place, it goes to the laboratory. It is the same way that it is basically the same way that drugs are sent to the patient. Very many times, in very many hospitals. They will tell you to go to the pharmacy to go and buy your drug or go this place. You know? But what happens in the center is that drugs are put in the pneumatic system, and from the pharmacy it is transmitted to all the wards that the patients are. So people and relatives don't have to fall sick after the person they took to the hospital has been healed. But ladies and gentlemen, the impact that we made in the Federal Medical Center to our mind is in fact not the biggest impact that we made. The biggest impact that we made is the impact that we made on the healthcare system of this country, which has been recognized. In Adedamola, over the 8 years, all right, the automated financial model that we instituted has been adopted by 73 hospitals in this country, in 33 states of the federal, including all the hospitals owned by the Federal Capital Territory of Nigeria, as I speak today. The EMR model that we initiated has been adopted, okay, by 103 hospitals across 28 states. Right? The remote laboratory review, you know, you go home, you are taking your lab, and then they tell you to come back so that you can come and review your laboratory results with your doctor. All right? We have a remote view that you sit right in your sitting room and you are able to review all your laboratory results. Okay? And then, of course, like I said, we have trained 18 hospitals across seven states in this country. We have hosted study teams, including states, including civilian, including military, from over 150 hospitals across all regions of Nigeria. We have mentored over 60 hospitals across the length and breadth of this country, and 176 hospitals. And when I talk of hospitals, I'm not talking of the one flat clinic. I'm talking of tertiary hospitals, secondary hospitals, and the entire states. Over 176 hospitals in this country have adopted one or more best practices from the Federal Medical Center. So to us, this is the biggest impact that we have been able to make. And of course, a lot of these things have been recognized with awards for leadership. But the most important one is the one by the late President Muhammadu Buhari, when he honored me the national honor in May 2022, which I received on behalf of myself and on behalf of my colleagues who have contributed to this job that we have done. So, ladies and gentlemen, I stand here today, I believe, on behalf of all of my classmates, many of whom are here. And I say thank you to you. And I would like to say that When I left the University of Ilorin, I never knew that the day would come when I will have a lifetime opportunity of coming to this hall where we did our 100 level, if I'm not mistaken. We will address this gathering. Thank you very much. It's always seems the most important. Thank you very much.